Good afternoon. I'm Stephanie Courtney, and I'm here today with Dr. Lisa Bowen to discuss her involvement in Dr. Courtney's 3-day eye program. She's been with him since the inception of the program. Good morning, Lisa.
Good morning.
So, how long have you been an eye doctor?
I have been practicing for 19 years at this very practice. My first job out of school. I also was a patient here long before I was the doctor. So it's a pretty cool place to work and pretty cool place to be.
What type of patients do you typically treat here?
So I pretty much treat everything here. We do routine exams, glasses, contacts, obviously. I treat many medical conditions, glaucoma, macular degeneration. Those are pretty much the two that Dr. Courtney and I have been working with over the years. We also treat or deal with cataracts, red eyes, so kind of the whole gamut. We pretty much do everything.
Okay. So as the eye professional that's evaluating Dr. Courtney's patients, I'm sure you're aware of the void in conventional medicine
Exactly
for
right.
these patients.
Exactly right.
How do you feel about the current medical treatment that's available?
So the reason I love working with Dr. Courtney so much is because a lot of these patients that are into homeopathic medicine, they have no choices when it comes to their eyes. You know, if you have other systemic issues, you can go to homeopathic, holistic medicine, like we've discussed before, excuse me, but there's no real eye care protocol other than Dr. Courtney. So the reason I love it is because we have treatments for glaucoma, we have treatments for macular degeneration, you know, in Western medicine, we'll say, or what we're doing now, but those don't always work for some patients. Some patients have reached the limit of what we can do medically, surgically. Some things like macular degeneration, excuse me, there's not a great way to treat it other than injections for patients, but that's only specific types of macular degeneration. So these patients, unfortunately, are at a loss. There's no one else for them to guide them or explain things to them. So between Dr. Courtney and myself, I feel like we have a really good relationship. Obviously, you know, we're here to do the things that he does with the patients and see where they are, but I also really like it because he and I work really well together, where I'll call and say, this is another condition that we have to have our eye on, or, you know, there's some other things that maybe we need to do before we start the program. So I really like that it does fill that void. You know, there's only so much we can do, so this is something that gives those patients hope where there wasn't any before.
So knowing the seriousness of these eye diseases, how did you react to when Dr. Courtney asked you to come on board and what his intentions were?
So first, I was extremely skeptical, just because in school you're taught a certain way. You know, we're very stubborn. Once, you know, we know the path and that's where we want to be on. So first I was very, very stubborn about it. However, I did a lot of research on what he does. You know, we discussed it, we talked about it, and then I started seeing the patients, and that 100% convinced me. When you see these patients that are literally losing their vision in front of your eyes, and for them to notice the difference is so rewarding. It's amazing because patients, they will go blind otherwise. So it is very, very rewarding to see what we're doing. Fantastic.
How many patients have you and Dr. Courtney treated over the years?
Oh, that's a really good question. I mean, I'd say at least 100. I mean, it could be more. It's for 15 years. I mean, we've done many, many different 3-day protocols. The cool thing is, though, we see them from all over the world. I mean, we've had patients come from India, from Africa, to do this treatment program, which is just, it's amazing. It's really cool. So we've seen quite a few patients, and I hope to continue seeing them because it's really, really fun to do.
So Dr. Courtney describes his protocol as 85 to 90% of people will have a significant improvement in their vision in 3 days. And have you found that to be true?
Absolutely. I do multiple tests for patients when they come in, pre-Dr. Courtney treatment and post-Dr. Courtney treatment. So we're checking vision, we're checking pressure. A lot of times I'm checking visual fields. We're taking pictures of the macula. So when I see them back day 3, and again, very skeptical at first, thinking, what are we going to do in 3 days? It's amazing. The difference in patients' peripheral vision is significant. The difference in patients' central vision is significantly improved. You know, I tell patients all the time, these patients are low vision, mostly patients, right? They're not 20/20 patients. So sometimes it's hard to kind of measure where they are as far as acuity-wise because they don't even measure on the chart. and I tell patients when they come in, you know, don't get discouraged by the numbers. When I see them back day 3 and they say, Lisa, like, I can do things today that I couldn't do yesterday. You know, those are things you can't necessarily measure, but I hear it all the time. And these patients are now doing things that they haven't been able to do. They can play cards and see the cards. They can go fishing and see the bobber. So these are the everyday lifestyle things that I think are so significant to patients and why this works so well. And so absolutely I see it. And I show my colleagues, and again, they're completely blown away. This just doesn't happen. We don't see an increase in visual field. You know, we don't see improved vision with patients with macular, but with these treatments we definitely do. So it's really cool.
So these participants are coming from across the United States and across the world, and they get confident in your ability to be their eye doctor forever. How have you seen that their vision has responded long term?
Long term. Everybody at this point is holding steady. You know, we have had a couple patients maybe that they had one disease and another disease kind of came in. Cataracts is kind of one example where cataracts, Dr. Cordy, have been working on cataracts for a while. Cataracts are very hard to gauge. You know, you kind of want to get cataracts before you kind of start noticing issues, and a lot of these patients are older, so you know there may be other interventions that we have to do. But overall, they are so happy. And you know that because they keep coming back to see us, right? They keep coming. I say, when have you seen Dr. Courtney? If they're not necessarily following him routinely, they're following me routinely. So we can be in communication if there's any issues. But no, these patients are pretty much long-term patients. Even patients that are out of the state, sometimes out of the country, they're coming back. So that is definitely a significant indication to me that what we're doing is working.
So what advice would you give to patients that are considering going through the 3-day eye program?
Absolutely. I think if there's a condition that you have that, you know, that you're struggling with, that you don't necessarily even want the traditional treatment. I mean, we've had some patients that are very anti-surgery, very anti-medication. So these are patients that I feel like if you think you have a problem and you're not happy with your current treatment or what you've been told, I definitely think it's worth to talk to Dr. Courtney and I. I mean, I can even do a preliminary exam just to kind of give you a second opinion or kind of make sure we're all on the same page of where we need to be treatment-wise. But absolutely, I think we're doing great in that regard for sure.
Well, thank you very much for talking with us today.
Absolutely. It was wonderful to be here, and I hope to continue working with Dr. Courtney into the future.